How to manage depression without medication. Do you hate the idea of using a prescription medication to try to manage your depression? If that's you, then you are in the right place. I'm here to answer that question in today's video. Let's dive right on in. Hi, I'm Dr. Kelly Shockley, Doctor of Cause Chiropractic, board certified in sports medicine and specialized in clinical nutrition. In this video, we're going to be going over the number one variable that could be continuing to weigh you down. Then we'll uncover a little known detail that could be part of the underlying cause of why you're continuing to struggle with depression. And then finally, I'll be sharing with you the behind closed doors method for ending your depression once and for all. Let's get started. The number one biggest variable that could be continuing to weigh you down is the standard American diet. The way that we do food in America is really not set up to help make us healthy, which is really unfortunate. The standard American diet stresses your body. There are far too many inflammatory producing foods that you are consuming if you're eating the way that most of Americans do. Inflammation is the root cause of all disease and illness, and one of the areas that is so incredibly vulnerable to inflammation is your brain. Your brain is 100% connected also to your digestive system or your gut through the nerves that communicate back and forth. So by ingesting all of these foods that create inflammation in your system and inflammation in your gut, you are directly creating inflammation in your brain. The way you can think of that is it's like your brain is literally on fire. And if your brain is on fire, there's no way you're going to feel happy about that whatsoever. There's no way you're going to be motivated to get out of bed. You are going to do whatever you can with what you have. And ultimately, when the brain is not functioning the way that it should, the types of symptoms you can start experiencing would be depression, but also like anxiety, lack of focus and concentration, living in a mental just brain fog, not being able to remember things the way that you used to, and so many other details. You see, the food that we've been conditioned to eat in America has been altered. We live by convenience because this is the society that like you have to get things done immediately. There's never downtime. We're all about instant gratification. So unfortunately, over the decades, it's really kind of set us up for failure. So the foods that you know are generally not the healthiest to be eating are ones that are really good at promoting inflammation. So you know the fast foods, the processed foods, anything that comes prepackaged for you generally has been compromised severely and ultimately is going to be stressful on your body and create inflammation. But a couple of other factors that we've been led astray on or misinformed about, one topic specifically would be grains. Grains are a carbohydrate that is actually more stressful for you than sugars. If you want to create inflammation in your body, sugar is like one of the best things to consume. But what works even better are the grains that we've been taught to eat at every single meal. So starting to move away from that standard American diet and going more towards a diet where carbohydrates are the least amount of your calories, not 60% like we were taught back in the 70s, that still hasn't changed, but like 20% or less, and trying to eat food as the way it grows in nature will serve you so much better. Part of what that will do is it's going to start nurturing your digestive system again, which when your digestive system is working better, your brain is also going to work better because of that connection between those two systems. Now, I'm curious, did you know that what you eat has that much influence over how you're feeling or how depressed you may feel from a day-to-day basis? Let me know in the comments down below. I'm really curious to hear your thoughts. We're going to talk about that little known detail that might be part of the underlying cause of why you're feeling depressed in the first place. This is not something that will get resolved by seeing a therapist or doing different emotional techniques like emotional freedom technique. It can't affect this. So I like one of my colleagues, Daniel Amen, I like his verbiage in the fact that depression, we label that as a mental health illness, right? And that gives a negative connotation because of, unfortunately, how our society has always viewed this. But ultimately, it's a symptom that's coming from a system that is not working properly. That symptom is associated with brain health. So just like if your heart isn't healthy It's going to start giving you different symptoms like a fast heart rate or palpitations, maybe high blood pressure. It's the result of the heart not being healthy. And what happens when the brain is not healthy, you're going to start experiencing symptoms that are associated with brain function, which ultimately includes depression, anxiety, lack of focus and concentration, things more simple like brain fog or lack of short-term memory, even migraines and other, neurologic types of patterns. So it's incredibly important to not just be putting forth work and trying to work through why you're depressed, whether it was a catastrophic event or something traumatic. That's incredibly important. But also there might be an underlying reason as to why you're not moving forward the way that you should. One of the things that I see all of the time that is not talked about at all, or at least on a very low level, are underlying toxic issues with heavy metals. Now, what in the world am I talking about? I'm talking about heavy metals like mercury and lead, aluminum, arsenic, barium, cadmium, uranium, titanium. These are all heavy metals. And here's the thing with heavy metals. They're everywhere in our environment. They are something we are being exposed to on a regular basis, regardless of how we're eating, because it's in our air, it's in our water, it does end up in our food. It's in a lot of the herbicides and fertilizers, pesticides that are being used on our food crops, which is part why it gets into our food. It's in a lot of our household types of products, including hygiene products. Antiperspirants contain aluminum. That's why you don't sweat, is they clog the pores with aluminum. Well, that gets absorbed into the system. Just like cosmetics contain a lot of different heavy metals because it helps hold the pigment, and that gets absorbed into the skin. Even, sunblocks and other like shampoos, conditioners, and then everything you use in your house for cleaning are all areas of exposure. Didn't used to be that we were bombarded all of the time, but we are continuing to be bombarded more and more. And the challenge with heavy metals is our body can help remove toxins from its system, but heavy metals are difficult for it to do. And the body actually has to be functioning at a higher level in order for that whole process to even work the right way. So here's the thing. If your body is struggling to keep up with what you're being exposed to, and it's not having the nutrients it needs in order to get you all the way through its detoxification process that it normally does regularly on its own, then those heavy metals stay in your body. And if the body doesn't do anything as like a last-ditch effort, those heavy metals will cause cell damage. So what the body does as this last-ditch effort is it surrounds those heavy metal molecules with fat. Fat neutralizes their function so they can no longer hurt you. Now, how is this related to depression? Well, as I was mentioning, depression is a symptom of a brain health issue. Your brain, depending on what site you source, is anywhere from 70 to 80% fat, which means it has a high affinity for storing toxins because it's a rich source of fat in your body. Now, I do testing on my patients, and I have found all kinds of crazy heavy metals in their system that they had no idea about. And you start working with them through the process of removing them while working on a bunch of other lifestyle factors. And it's phenomenal how much progress and how much better they can start feeling. So heavy metals are really a very common problem. And if you are dealing with depression and you've been going through and doing all the work to try to move past it, move forward, kind of redefined circumstances to help free you, and you're still not making progress the way that you would expect to, or want to, or haven't fully resolved the issue as much as possible, this is something you might want to explore more on, is heavy metal toxicity. Now, before I get into the behind closed doors method for ending depression once and for all, I want to just remind you quickly to subscribe to my channel by clicking that button down below, turn the notifications on. I am producing content regularly around how to optimize brain health, how to improve gut health, and everything to help you be able to take back control of your health so you can achieve what I like to call total body mastery. So just click that subscribe button, turn the notifications on, and you will be set. Awesome. Okay, what is this behind closed doors method that will help end your depression once and for all that I'm talking about? I alluded to it a little bit earlier. It's proper testing. If you're not testing, you're guessing, okay? And this is probably not something that has been done in a medical office before that you've been to, because they don't do this kind of testing. What I'm talking about is complete whole health, full body testing, which also includes then things like heavy metal testing. People don't do that on a regular basis. If you really want to be able to understand why you're still struggling with depression, then knowing what the current level of your health is, knowing where your brain health is at, and everything else related is really important to help formulate a plan. As I mentioned, walking through the process and, going to therapy, working on releasing emotions through like emotional freedom techniques, what have you, is incredibly important. But here's a thought. Have you ever known a situation where a person was in a car accident and they walked away and they're totally fine, like they're not affected by it at all, they can get in the car, like they're not apprehensive whatsoever, and then known somebody else get in a car accident that is now fearful of getting in a car and driving down the road because they're worried they're going to get in an accident again? Even if we could do this and make their experiences identical, the way people walk away from circumstances can be different. And part of it is the internal wiring of how the brain is working or not working. Some of it needs to be, discussed and figure out what is the underlying details, stories that we're telling ourselves. But the other side of that could be differences in level of health of the brain. The person who walks away totally fine, brain is probably functioning at a pretty high level. The person who walks away fearful and now their life, like quality of life, is totally down the drain because they can't handle getting back into the car, more than likely there's an issue with the brain and something is not working right that is keeping them in this fearful cycle. So if you want to take whatever therapy you've been working on with your depression and put it on steroids, actually healthy steroids if there's such a thing, put it on like full tilt and actually really help resolve it, then you need to be able to evaluate your current level of health and address any of the imbalances and issues that are there, specifically with brain health, if you want to be able to fully move forward. Now, there's more on that in another video, and I'll share that with you, I promise. But what I want to share with you today is one of the most important things you can start doing to really decrease the level of your depression is focusing on that first thing we discussed, not eating the standard American diet. Now, if you have no idea what that actually looks like, don't worry, I've got you. Down in the description below, you will see that there is a link for a free 7-day Eat Your Way to Better Brain Health meal plan that I would love for you to take advantage of. This 7-day meal plan shows you exactly what it looks like to be eating for optimizing brain health. And it's something that was created by me, a busy single mom with an actual in-person clinic and an online business. Like, time is very, very limited. And I wanted to create a meal plan that was actually doable for people who were busy like I was, or for people who don't even like cooking or don't want to spend all of their time in the kitchen. This is super simple to follow. It's easy to implement. You do not have to cook every single meal every single day. And I've also included your grocery list, so it's super convenient. You just check off whatever you already have, and then you know what you need to get to make all of the recipes for the week. And the recipes are delicious. They've been kid approved. They're easy. They are not labor intensive. They don't have a bazillion ingredients in them either. I created this to help this transition be as easy for you as possible. So take advantage of this free 7-day meal plan. And I guarantee you by the end of the 7 days, you will have a difference in how you feel. I can't wait for you guys to try it out. Click the link down below in that description. Thank you so much for being here. And I look forward to seeing you on a future episode. God bless.